I'm Rosa Whitaker. Welcome to Dominion TV's special on COVID-19, Africa's Response and Solutions. I'm joined now by Dr. Ahmed Ouma, Africa Center for Disease Control Deputy Director. Greetings, Dr. Ouma. Thank you for joining us today.
Thank you for having me.
I know this is a very busy time as the Africa CDC is on the front line in fighting this coronavirus. Could you paint for us an overall picture of how Africa should be bracing and how the continent is bearing up under this environment? And tell us what is working and what is not working, and what is the appropriate African prescription to win this war against the coronavirus?
As of today, we have just over 36,000 confirmed cases on the continent, and we have just over 1,500 deaths that have been connected to COVID-19. So in general, the numbers in Africa compared to other parts of the world is still relatively low, but it's growing, and we are watching the numbers very closely to ensure that our response is tailored to ensure that the numbers remain low. So this is the situation in Africa. Second is it started later than other places in the world. The first case in Africa we saw in mid-February, and the numbers really ramped up sometime in the middle of March. So we've had a little bit of time to be able to put a response in place. And this is one key difference between what happened elsewhere in the world compared to what is happening here in Africa. Governments moved quite quickly with our support to enforce social distancing. Government moved relatively quickly to inform their public, their citizens, of what were the key things that they need to do to be able to stay safe. And governments also moved quite quickly in providing strong policy guidelines to ourselves as Africa CDC and Africa Union. And we have been using that guidance to provide the technical support that is required. What is working in Africa is that there is a lot of solidarity. Countries are working together. Actions are being taken in groups of countries, not just one country. And we are seeing this solidarity is actually resulting in very good dividend, because we are seeing the numbers going up, but not going up very fast. We are using resources also communally. When we started intervening, there were very few laboratories in Africa, but those few were being shared by countries that are neighbors. And today, over 50 countries have the capacity to be able to test. So we've been using resources communally. So that is working. What is not working very well in Africa is the response to rumors. There's been too many rumors flying around with information that is incorrect. And this is resulting in complications of our response, supporting governments to be able to provide good information. Second thing that is not working is the ability to deploy experts with lockdowns and the airspaces being closed, and with the experts not being so many on the continent. We are finding it a challenge to be able to distribute the experts that we have across the continent. So in general, we are in the morning stage of our outbreak. The numbers are rising, and we hope that we will flatten this curve before we reach the evening of the outbreak.
Dr. Ouma, thank you so very much.
Thank you, and stay safe.
We invite you to join the conversation. Tell us what you think on all our social media platforms at My Dominion TV.